I'm Yasmin Bradfield. I'm a pediatric ophthalmologist here at the University of Wisconsin, and I'm a faculty in our department.
And I'm Michael Struck, also one of the pediatric ophthalmologists at the University of Wisconsin. And we practice together at the university clinics. We have been active and open and seeing patients since late 2020.
So it's very safe for families and parents and young children to come in for their eye exams. Even if it's not an urgent exam, even if it's a scheduled annual dilated exam, we're able to do that safely here in our clinics.
So many of our patients come from well outside of Dane County. And for those patients, we prefer to work with a local eye care provider in order to assist with follow-up care of our patients and care in between exams when they can come to the university. So we are actively seeking people outside of Dane County or even within Dane County to assist and help support the management of the ophthalmology condition for the children that we take care of.
A lot of referrals from outside of Dane County, and we're able to manage and give them high level of care, specialty care here at our pediatric ophthalmology clinics. And a lot of times once we're done with either surgery or getting their vision improvement, we're able to return patients back to you as a referring optometrist.
Since we've been actively seeing patients again post-COVID protocol, we have greatly expanded our capacity, and currently our waiting period for new patients is in the 2 to 4 week range. We are able to see patients quickly and efficiently and safely.
So we see everything from strabismus, which is eye misalignment, as well as pediatric conditions like cataracts, glaucoma, droopy lids, tear duct obstructions, and really anything else that involves the pediatric vision or their eyes.
Occasionally we will work in conjunction with other specialists, the retina specialists or the oculoplastic specialists, but in general, the patients will be referred to our clinic to begin with, and then depending upon the level of need that they have, we'll work with other specialists in the UW clinic or the Children's Hospital to provide full service care.
So we have a whole team here to support your patients and families, and it's not just Dr. Struck and myself, it's also Dr. Terry Young, who's the chair of our department, and she actually has a genetics lab looking at pediatric myopia or nearsightedness, as well as retinal and genetic and glaucoma diseases, as well as Dr. Schmidt, who has her own pediatric ophthalmology interest in retinal dystrophies, and Dr. Miranda, who's our newest faculty on staff, and he provides comprehensive pediatric eye care.
Also, in addition, Dr. Dave Gam, who's a researcher in stem cell disorders and runs a regular clinic in pediatric ophthalmology as well. One of the main benefits of our clinic is that in nonverbal or preverbal children and or children who have a genetic disorder, we have an extensive electrophysiology testing lab right here in the clinic that we can provide ERG and visual evoked potential VEP recordings for those patients in order to diagnose and better serve their condition.
It's very helpful to have the VEPs here, which we're actually one of the centers in the entire country that have the ability to tell you what your families or children's vision is before they're able to tell us that. You may have heard of the myopia epidemic that has been occurring, and virtual school and having to have children stare at their computers all day long really hasn't helped that. And so we offer a broad range of myopia therapies here for children, including being involved in atropine studies, which is an eye drop to try to decrease the rate of progression of high levels of nearsightedness that can lead to all sorts of other vision problems, including blindness. As well as Dr. Terry Young, who's the chair of our department, has a myopia genetics lab that she's very interested in enrolling families with a history of myopia in. And then we also have specialized optometrists who can help with contact lenses in children to try to decrease the rate of myopia progression.
We appreciate the years of support of sending your patients to see us here at the University of Wisconsin. We're always happy to be involved in the care of your patients and to be a participant in better care for children and their eye care.
And we hope to see your families and your patients soon.